don't want to waste any time, so let's get started. And this is Dr. Melissa Congdon, and welcome.
Thank you so much.
Oh, Rihanna, so good.
Yes. Thank you so much for inviting me. Should I use the microphone?
Yes.
Oh. I'm so happy to be here, and I'm really happy that I didn't wait until this morning to review my notes. Your questions are also wonderful. I'll try to answer all of them. I can't answer specific questions about someone's condition, and because we have to keep it general, and I haven't mapped you, and I'm not your physician, but I'll do my best to answer general questions. And so what I thought I would do is I would read parts of the questions and then answer. Okay. So the first question, hi Annette, thank you for your updates. I really appreciate all of them and your hard work. I just wanted to give that plug in to you, Annette.
Oh, gee, thanks.
Very appreciated. One question I think Dr. Congdon might be able to help with is, what is the scientific approach to helping diagnose fibromyalgia? When I explain to people about my conditions, symptoms, trials, tribulations, etc., many of them say something to the effect of, yeah, I feel those things, and my doctor tells me it's this, but I don't think so. I think the resistance, ignorance, skepticism that fibromyalgia sufferers run into makes them retreat into suffering into silence kind of mentality, with little hope of getting out. If there were a more, quote, scientific method of diagnosing them, I think they would feel like there's something they can look forward to. And I know that this would make it harder because there isn't a lab test that substantiates this. And of course, the other hurdle would be to publicize this method, bringing education and awareness. Okay, so y'all are going to get a little genetics lesson because there is research being done, genetic research at the City of Hope and other institutions. And what they're looking at is they're trying to find out if there is a way to tell by blood tests if people with fibromyalgia have a unique genetic pattern. And what they're looking for is, in our genes, in everyone's genes, they are like traffic cops. They direct certain proteins to be made and how many proteins are made at certain times. So what happens at City of Hope in these research centers is they study people with fibromyalgia and everyone in their family, and they put blood test results or blood test information into huge computers, and they run thousands and thousands of tests. And they have come up with a number of proteins that are unique in people with fibromyalgia. And the proteins they are studying are immune system proteins. They're called chemokines and cytokines. So far, the researchers at the City of Hope don't have a test that's sensitive or specific enough, meaning that they don't feel comfortable releasing this test because it might miss someone with fibromyalgia, or it might tell someone who has lupus that they really have fibromyalgia. You might hear about a fibromyalgia test that's commercially available. There's an entrepreneur in Los Angeles named Dr. Bruce Gillis. He's a physician. And he founded a company called Epic Genetics. And he used the chemokine and cytokine measurements, and he came up with what's called the FM, it's capital, and then /A test. It's not widely accepted in the medical community for two reasons. First of all, it was only 93% sensitive and specific, and that wasn't good enough for the researchers. Now he says it's 99% sensitive and specific. And it has never been validated by an independent peer-reviewed study. Nevertheless, it's getting a fair amount of press. And some insurance companies are covering it. It started out, the cost was $749, now it's $936. But it does, even though Dr. St. Amand is also one of the people, myself included, that this test was perhaps released prematurely, it does start getting the information out that yes, there are specific chemokines and cytokines immune system proteins that are unique in people with fibromyalgia. If you look at Dr. St. Amand's website, the City of Hope has 3 research studies that talk about the chemokine and cytokines. And interestingly, in one of the studies, people who had been on guaifenesin for some months had a change in the chemokine and cytokine pattern. So, so guaifenesin does have an effect on these immune system proteins. Okay. So that is the first question. There will be a scientific way, in other words, a blood test way to diagnose fibromyalgia. So let's go into a little bit of history really quickly about fibromyalgia. In 1990, the World Health Organization finally gave the syndrome a name, officially declared that there was something called fibromyalgia, and they just talked about chronic widespread pain. Didn't have any information about the non-pain symptoms of fibromyalgia. And they talked about tender points. Tender points was never meant to be something to be used in clinical setting. Doctors were not trained how to do this. This was just supposed to be a research tool. And in 2010, a study was done and found that the tender point exam missed 25% of people who were known to have fibromyalgia, people who were diagnosed with fibromyalgia by their rheumatologists and neurologists. So the American College of Rheumatology looked for a better way. And they developed the new clinical fibromyalgia diagnostic criteria. And I'll leave this for Annette. Basically, it's composed of 2 major things: the widespread pain index, where, and this is something that is done by the patient before they see the doctor. It is just history-based. And so you mark where you felt pain over the past week, and then at the bottom, there's something called the Symptom Severity score, where you indicate your level of symptom severity over the past week in the following categories: fatigue, waking unrefreshed, and cognitive symptoms. Wait, there's something more than pain in fibromyalgia? So this is wonderful, right? In 2010, doctors said, hey, listen, the tender point, things are really missing a lot of people, and we need to become more aware of what's going on with people with fibromyalgia. And on the back, there are a lot of other symptoms common in people with fibromyalgia. And so what you do is you tally up your score, widespread pain index and symptom severity score, and if your score is over a certain amount, you are likely to have fibromyalgia. Then you take that to your doctor. The doctor checks to see if you have chronic widespread pain. In my clinical experience, anybody that has chronic widespread pain and non-restorative sleep has fibromyalgia unless proven otherwise. It's not complicated. So that's when you have your thyroid test done, make sure you're not anemic. In certain areas, make sure you don't have Lyme disease. Other things that could be causing chronic widespread pain and non-restorative sleep. But I'm trying to teach healthcare professionals to just ask this one simple question in their patients with chronic widespread pain. when was the last time you awoke feeling rested? And if you get the, maybe when I was a teenager or years and years, then there's a high likelihood of fibromyalgia. So anyway, the rheumatologists and neurologists are still fighting over what is the best method for diagnosing fibromyalgia, but this, I think, is an important tool for people to know about if they want something to bring to their doctors. It's a way to start a conversation. And then Dr. St. Amand and I, over the years, have been teaching the mapping evaluation to a lot of people in healthcare. As opposed to Bruce Gillis's test, it's cheaper to have an appointment with Dr. St. Amand and me, and it's 100% sensitive and specific, the mapping exam. You know, same thing with Vicki, it's 100%. And it's really fascinating what I've seen in the past 8 years when I've been teaching healthcare professionals about mapping. I used to be in an integrative medicine practice in San Francisco. We lost our lease, and so we kind of scattered. I'm still with one integrative medicine doctor, but there was a Lyme disease specialist, and she was very interested in what these nodules were and very dismissive. Oh yeah, well, yeah, they're just little tiny swellings, and we all have those. And one of the requirements of being in the integrative medicine group is we shadowed each other. And so in the day that she shadowed me, it was like the aha phenomenon. She was like, oh my gosh, these things are real. And so now she sends me Lyme disease patients who also have fibromyalgia, because sometimes we don't just have one thing. And so around the Bay Area, for the people that I have taught, and in Colorado Springs last year when I did a mapping seminar, I get people referred to me because their doctors, I teach them how to map the left anterior thigh, and if they have nodules, they send it to me. So, that's the dream, right? Because that is the most sensitive and specific. But how do we get there? We get there by trying to get our doctors aware of what's going on, maybe bring this. I recently took some time and went over all of the current studies that have been published in the field of fibromyalgia that I thought would be most interesting to people, and I sent that in an email to Annette, so she has that. And they're good review articles about fibromyalgia in general, and then there are articles that are specific about what things are unique in fibromyalgia patients. So there have been so many study results that show that we have unique biochemical and physical findings. So that is the answer to the chemokine and cytokine and the scientific approach.